Good day and welcome to the St. Louis County Department of Public Health. Today we are talking about COVID-19 and an explosion in new cases. I'm Christopher Ave and I'm joined here by our Chief Medical Officer, Dr. Emily Doucette, as well as our Director of Communicable Disease Response, Nebu Kolancherry. Thanks for being here. And we are going to learn now more about what this increase in COVID-19 cases really means and what you and I can do to protect ourselves, our loved ones, and our community. So Nebu, as we sit here in early January, as we're taping this, we're seeing the highest number of new COVID-19 cases ever in St. Louis County. So my questions for you are, what does this actually mean for us? And what are some steps that we all can take to protect ourselves and our loved ones?
So you're exactly right, where today is the highest rate of cases and hospitalizations that we've ever had over the course of the pandemic in St. Louis County. And to put that in perspective, 3 weeks ago we had about 2,800 new cases, while last week that number went to 12,000. We haven't seen that steep of an increase really ever. And what that means to the average person is that they are most at risk than they have ever been for being exposed to COVID-19 while living their everyday life. And on average, what that means is about 1 in 12 people in St. Louis County currently are COVID positive and may be infectious. And, most of us see way more than 12 people in any given day while living our lives. Now, while that may seem kind of, hopeless, the good news is that we still have every tool that you need to protect yourself in our toolbox. First and foremost, at this state, it's masking and social distancing. And the best evidence that works is in our classrooms, in schools and in universities, where while people have been getting COVID outside of the classrooms, children and students, university students, have really not been getting COVID by being in class. And the biggest reason is that they are masked. So we know masking works and we know social distancing works as well. Right now it's probably also wise to really think about avoiding large social gatherings, especially if you or someone that you love are at high risk for contracting COVID and getting severe disease. So, let me tell you what that means for me. The most vulnerable person, if you will, in my life is my best friend's 8-month-old kid, Jack. And Jack can't get vaccinated, so what I do is I'm not going to see Jack for quite some time until I feel like it is safe to do so. The next most important thing, again, is as we've stressed throughout the course, as we've stressed as much as we can, is the vaccination. Now, while the Omicron variant is new, the vaccine is still very, very protective against severe disease. It'll keep you from going to the hospital, and it'll also protect you from. It'll offer significant protection to you if you're boosted. It'll offer significant protection to you if you have a booster dose from getting the disease.
Good deal. And so, if I am trying to figure out, is it worth it for me to get vaccinated or is it worth it for me to get boosted, what would your advice be?
Well, I'd say it's the single best tool that you have to protect you and also the people in your life that you love. I mentioned that last week we had 12,000 new cases. Over 70% of those were in people who didn't get the vaccine. And those are great odds, and I would play those odds.
Excellent. Thank you.